This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday on WAJR. Mon Health Talk for this Monday on WAJR. Thanks for joining us. Our guest this morning is Alicia Bowser, family nurse practitioner in cardiology at the Mon Health Heart and Vascular Center. And Alicia, good morning. Welcome to the program. Thanks for joining us.
Good morning. How are you this morning?
I'm doing well. Let's talk a little bit about your background and where you're from and what your interests are and what led you to this particular specialty.
Well, I actually grew up in Terralta in Preston County and currently live in Brewston with my husband and my children. I have two undergrads from WVU and then got my master's at Chamberlain University. Growing up, I had a lot of family who had heart disease, and they had different battles to have to face, and I watched them having to take care of those situations, and I wanted to learn more and to help others who were having trouble with the same disease. Mon Health is a local hospital who is able to help people when they care about each patient individually, and I currently work at Preston, and I wanted to be able to help those that live in my county and have more access to specialty care instead of having to go to Morgantown.
Okay, so it was a natural fit for you getting into this specialty and being able to stay right there in your home county. That's got to be very gratifying.
It's wonderful. I get to see people that I've known over the years that get to help others, and I understand the population at least a little bit, and their concerns of having to drive off the mountain, as we say, and having to go to Morgantown.
Okay. So February is American Heart Month, and this Friday, the American Heart Association's National Red Day. So why is this important? And again, you're on our program this week, so obviously this is something that's close to you and kind of near to your heart.
The great part is that February, of course, we focus more on the heart, and it's an excellent time to raise awareness for heart disease. And this week, of course, is Women's Heart Health Go Red on Friday, and then we want to focus more on teaching women about the concerns for heart disease. It is actually a leading cause of death for women in the United States. 1 in 5 females die due to heart disease, and awareness is very important in teaching the women what things to look for whenever, and understanding the risks and the activities that they do that can affect their lives.
Okay, so those numbers very high. You say 1 in 5 affected by heart disease in some form, and a lot of times that leads to premature death. So what are the symptoms? What should women be looking for?
Well, women are different than men, of course. We have unique symptoms. We can get nausea, jaw pain, fatigue, or shortness of breath versus what most people see as a pain in our chest. And it's important to understand those differences and that we could just ignore them because, of course, most people ignore, a jaw pain, oh, I must have done something, or they're tired more than usual. But those are more symptoms dedicated to the women and that are seen. Okay,
so I'm sorry, go ahead.
No, it's okay.
All of those things combined, all of those symptoms combined, that's obviously any of them can be a red flag, but if you're experiencing multiple symptoms, that's when you need to take steps to get checked out, right?
Yes, definitely. And the great part is that here in Preston, we have a local ER that they can go to and just to get evaluated.
Okay. Talk a little bit, let's take one step back and talk a little bit about the American Heart Association's Go Red for Women. What's that involved? What are kind of the details with that?
So with Go Red for Women, we have National Red Day on Friday, February 7th, just so that we can help raise awareness. And we encourage all women to wear red that day. so that we can start advocating for our family and friends and teaching them to watch, what they eat, what extracurricular activities they have, and exercising, so that they can be more focused on their personal health.
Mm-hmm. So those symptoms we talked about, and if you, again, if you're feeling those symptoms, especially multiple symptoms, what's the next step you need to take? What do you need to do to help yourself?
Well, first we need to focus on the risk factors: high blood pressure, high cholesterol, diabetes, and obesity. And of course, as women get older, we have hormonal changes in menopause, and of course pregnancy and autoimmune diseases that can affect our heart. We need to consider working on smoking. Our sedentary behavior and poor diet choices also increase our heart health risks. Stress and mental health are very important, because unfortunately, when we feel chest pain, we think that it's possibly our heart, but we also have to rule out if it is anxiety, and we need to be focused on both of those in general. Okay,
obviously smoking's a big one. It's a huge one, and overall health. The minute you put the cigarettes down and just stop, your overall health improves almost immediately.
It does. And the challenge is to be able to, fight that part of your life and to go, wait a second, I deserve better. I want to live longer, and I can do this, for health down the road.
Okay, so that's probably the biggest risk factor. Others, as you mentioned, a sedentary lifestyle and diet. So, those three things combined, eliminating the smoking and kind of keeping a closer eye on your diet and moving around a little bit, right? You don't have to run a marathon. You just need to walk around the block, or, just do some small incremental changes.
Yeah, and the goal is for exercise is we aim for 150 minutes of moderate activity per week, which equates to about 30 minutes, 5 days a week. And that's just a focused walk. You can go with a friend, family members. Even at lunchtime at work, you can go and find a short walk, around outside or inside if there's enough room, and just focus for yourself and for your family down the road.
Okay, you mentioned some chest pain maybe being a symptom of anxiety. Can you talk about that a little bit, and what differentiates maybe some discomfort due to anxiety compared to the discomfort in the chest if something's going on with your heart?
Well, that's the challenge, is that everyone feels pain differently. And it's more important that it's best if you do experience those symptoms, you get it checked out. And that if you are ruled out, and we go talk to your primary care provider, we talk to, if it's severe, you go to the emergency room. And if those symptoms you rule out, is what we say, and that your troponins are negative and that we don't feel that it's a cardiac concern, then we focus more on your mental health and stress, because, of course, stress and high blood pressure can lead to heart disease, and it is very important to control those.
How important is it to know your numbers in terms of blood work? You mentioned some of these risk factors and some of the symptoms: high blood pressure, high cholesterol, diabetes. Those are all things that can be kind of monitored through, an annual checkup with your blood work, right?
Correct. So high blood pressure-wise, the goal is for a blood pressure no more than 140/90, but a good blood pressure is 120/80. Cholesterol-wise, cardiology, we look at the bad cholesterol, and our goal is for it to be less than 70, triglycerides less than 150, and a good cholesterol, which is the HDL, of over 45. Diabetes, we hope that their blood sugars are controlled and that their A1C is less than 7.
Mm-hmm. Are those numbers similar to men's numbers, or are they different for women?
Those are the same for both both genders, and that we keep it at a regulation. There are occasions that females' blood pressure has a little bit of leeway, but for the most part, we focus on 120, and it starts to elevate into the 140s that we need to start, medicating and doing something for that.
What are some programs offered by Mon Health, either at your facility there in Preston County in Kingwood or in Morgantown? Are there programs offered for women for smoking cessation and for mental health? Are there places to turn to get help with these things?
Definitely. We have, each patient visit, we encourage smoking cessation, and we have those that can reach out to the patients. And we also have offices in the community that are able to help patients with their mental health, and we encourage them to reach out to them or talk with their PCP and have them arrange those appointments.
Okay, what's the number for the Kingwood facility in Preston County?
304-329-4701.
So 304-329-4201. 47, okay.
47.
Can't read my own writing. 4701. 329-4701 for the facility in Kingwood. And the Mon facility in Morgantown, do you know that one?
304-598-8802.
All right, so we encourage people to reach out if you think you have issues. Again, this is an excellent time to raise awareness about heart disease. February is American Heart Month, and Friday, the American Heart Association's National Red Day. So, now's the time. If you've been affected by some of these symptoms, or if you need some help, if you're interested in stopping smoking, if you're interested in just leading a more healthier lifestyle, or if you need some help with mental health issues, give Mon Health a call. Again, that Preston facility where Alicia is located, 304-329-4701, or in Morgantown, 598-8802. This is Mon Health Talk for this Monday, February 3rd. We'll take a quick break. We will continue the conversation with Alicia Bowser, a family nurse practitioner in cardiology, Mon Health Heart and Vascular Center, again, based in Kingwood. We'll take a break. We will continue the conversation after this on WHAR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk on WHAR for this Monday morning. Our guest, Alicia Bowser, family nurse practitioner in cardiology with Mon Health Heart and Vascular Center, and she works out of the Preston County location in Kingwood. You can reach Alicia at 304-329-4701. And welcome back. Thanks for staying with us. We talked in the first segment about the risk factors and the symptoms. So what can women do? Again, this is American Heart Month, and Friday is the American Heart Association's National Red Day. So as an expert on women and their cardiac care, what can women do to kind of take control of this?
Well, the most important is, of course, taking control and having to make the decision that you want to put yourself first. You also need to know your family history and discussing those risk factors with your healthcare provider. And, of course, regular screenings with your blood pressure, cholesterol, and your glucose levels that we talked about in the last segment are important. That those are the labs that you need to monitor. Focusing on healthy habits, a balanced diet that has adequate fruits, vegetables, whole grains, and lean proteins. We discussed earlier the regular exercise, aiming for 150 minutes of moderate exercise a week, and to, of course, limit alcohol and avoid smoking.
Okay. How much of this is genetic? I mean, sometimes you can do everything right, correct, and still have a problem.
Correct. There isn't a scientific amount that is genetic versus, modifiable risk factors. That's why we also have to be cognizant of those risk factors and understand that the things that we eat every day, the fact that we smoke, we drink, or that we're not getting adequate exercise can affect our genetics.
Mm-hmm. Okay, and again, we talked about mental and emotional health. That's very important, and it could be just as simple as talking to someone, right?
Correct. Because, of course, stress affects individuals differently at times. And I have a lot of patients that come in and they're like, I've had a lot of chest pain, but it usually happens when I'm very stressed. And we have found that stress, of course, then increases your blood pressure, which is a factor, and that can lead to coronary artery disease and makes everything unhealthy if we can't manage the brain as well as the rest of the organs in the body.
Mm-hmm. Of course, we'd like to see changes with diet and exercise and stop smoking, but medication sometimes is essential. So let's talk about that aspect a little bit. What are some of the more common medicines? And obviously, if you get with your physician, you get on a plan that includes all of those things, diet, exercise, and medication, you gotta stick to it.
Correct. Medications are very important, especially what we talked about with high blood pressure can be a leading cause with coronary artery disease and the cholesterol medications, and you need to take them. And a lot of people go, oh, well, my blood pressure is okay, so I don't need to take my medicines anymore. Well, the blood pressure is okay because you are taking the medicine and you need to continue. And if patients have had, heart caths and they've ended up with stents, they need to continue those medications to keep your heart healthy and so that you don't have any issues in the future.
All right, so again, this is the American Heart Association's Go Red for Women campaign. That's on Friday. And if someone out there is listening and this has prompted them to take steps to help themselves, what should those steps be? What are the next things they should do?
Well, start with scheduling an appointment with your primary care provider and discuss your heart health. And you can also visit monhealth.com to schedule that appointment. Have conversations with your friends and family and advocate for them to prioritize their health. And, of course, you also have to do that for yourself. Heart disease is preventable and manageable with the right awareness and action. And, of course, on Friday, wear red for National Wear Red Day to help raise awareness for women's health.
All right, so we want people wearing red on Friday to solidarity here, right? National
Correct.
Wear Red Day to help raise awareness. One more thing about, if you go see a physician, if you go see a heart specialist such as yourself, they're going to ask questions about history, right? Family history. So if you can, you need to know as much as you can about your family's history, parents, grandparents, siblings who have had issues with heart disease in the past, right?
Correct. So knowing if they've had electrical issues with your heart, AFib and such, that is important. If you have coronary artery disease, if they've had stents, if they've had a heart attack, if they have cholesterol, if they have if they have cholesterol issues, or if they had diabetes, those are all risk factors that, of course, your genetics have play in a factor and affect you.
Right. Get to know that heart history. Very good. Good information today, and we appreciate it. Alicia Bowser with us, family nurse practitioner in cardiology for Mon Health Heart and Vascular Center. Again, you can reach the facility, Kingwood, Preston County, 304-329-4701. Mon Health in Morgantown, 304-598-8802. And again, this is National Red Day coming up on Friday. Thanks again. We appreciate this great information.
Of course, anytime.
Alicia Bowser with Mon Health in cardiology, family nurse practitioner. That is Mon Health Talk for this Monday. Thanks for listening. Stay tuned. The news is next on WAJR.